everybody. Welcome to this special edition of On the Edge. I'm very excited to introduce Dr. Roslyn Mallory. Hi, Dr. Mallory. Thanks for joining us today.
Hi, thanks for having me.
It's such a pleasure to have you here. I had the opportunity to meet Dr. Mallory a couple of years ago when she and a couple of her colleagues were doing a podcast called The Vagicians. And I was so happy when she said she would join me again here on the Edge and have a chance to speak with her again. Dr. Mallory, could you tell us a little bit about yourself, and then we'll jump into our topic today, which is Black women in medicine.
Hi, my name is Dr. Roslyn Mallory. I live here in Panama City. I'm one of the OBGYNs here in town. I am originally from Decatur, Georgia, and I've been here in the Panhandle for the last about 13 years.
All right, great. So I know, Dr. Mallory, that you made a decision to go to med school. What was it that was a driver for you to go to medical school?
I think the driver was I always wanted to be a physician. I think it kind of started with, ironically, the Cosby Show.
That's awesome.
To say that now, but that's how it started, because that was my first look at Black professionals. That was my first intro into it, and I loved his relationship with his patients, and I loved the show, so that got me interested in medicine, and it just kind of continued.
And do you remember how old you were when you first started thinking, hey, I think I want to be a doctor?
It was like 7 or 8.
Really?
Yeah.
Wow, what a lifelong dream for you.
Mm-hmm.
That's wonderful. And tell us about the college experience, the academia experience. Where did you go to school?
I did my undergrad at Georgia State University in downtown Atlanta. I started there, and initially they were on the quarter system, and then they switched over to semester system, and I didn't believe in summer school. So I graduated 5 years instead of 4 years because I refused to go to summer school.
Good for you.
My transcript together. So we did that. And then I think it was the summer before I graduated, I did a Kaplan MCAT prep course, took my MCAT, started the whole application process to medical school.
Wow. And where did you go to med school?
I went to med school at Howard University College of Medicine in Washington, D.C.
And Howard is a traditionally Black university, right? HB. Okay, great. Historically Black university, which is what that stands for, correct?
Yeah.
Okay. And I want to talk to you a little bit about that experience. Was it before med school or after med school or in residency when you decided to go into women's health, OBGYN?
That was pretty much in like high school, junior high, when I decided I wanted to be an obstetrician. So that, and then I did my rotations during med school, and it was the only rotation that I was actually excited and happy every day that I was on the rotation.
Okay. So definitely this is where you were meant to be.
Correct.
Okay. And I want to talk to you about that school experience. I know that that there can be challenges just being a woman going into medicine. And I know that going to an HBU probably helped with the other side of that, being a Black woman. But what kind of challenges did you face being a woman at Howard?
I don't think we really even faced any challenges to being a woman at Howard. I mean, you still had your same specialties that were kind of like a good old boys club, but no, I saw female surgeons, ortho, general surgery, trauma. So it wasn't like I didn't see representation, and they weren't treated necessarily any differently than anybody else.
Interesting. So where do you think you came upon some challenges? Did you face it like going into school, maybe at Georgia? Did you run into any challenges, or did this just seem like destiny for you and everything aligned for this to be a great profession for you and your schooling?
For the most part, I would say that I felt like it kind of aligned. I felt like I had more issues maybe in residency that I questioned. However, I feel like going to Howard kind of helped me to cope with those a bit more, because at Howard we were pretty much all on an even playing field as far as your ethnic background.
Okay.
So you could take that out of the equation
Right.
and
Right.
say it's not because I'm black. They're on me not because I'm black, but because I don't know my information. And there's a difference.
That's good. That's good. So, did you consider any other universities for med school?
I did. I applied to several different ones, and it was honestly, between Howard and Meharry, which is another HBCU
Okay.
medical school, and I went with Howard.
So let's talk about your residency,
Hmm.
right? And where did you do your residency?
I did my residency at York Hospital in York, Pennsylvania.
Was that a different experience than the rotations you did in school?
It was a culture shock a little bit. I love York. York is a lovely town. But I think its proximity to Gettysburg kind of
Oh,
it's different. I tell people I saw more Confederate flags in York, Pennsylvania than I ever did in Georgia, and it was on the state flag for a while. And I
wow.
think it was just their proximity to Gettysburg more than anything else.
Did you feel threatened or put off by that, or was it just a shock for you?
It's just a little bit more of a shock. Like, I guess I did not expect to see it that far north, if you will. And definitely not on that magnitude.
Right. I had a interesting experience last year when I went to Charlotte, North Carolina, and exiting the airport and seeing Confederate flags. I'm in California, and they're not here. You don't see
Mhm.
Confederate flags here, especially not flying, right? You might see them on the back of a truck every once in a while up in the mountains, but you don't see it in LA, Orange County, or San Diego County. And so it was such a shock for me to see that. I don't know how to feel about it. Actually, it's been a struggle for me even thinking about it, and I wrote about it right away. So let's talk about when you first started your practice. I know
Okay.
that going into medicine, getting out of school, there's still that ramp up to build your practice.
Mhm.
How did you launch your practice? Did you join a group? Were you asked to join a group? How did that come about?
I joined a group here in town. It was a smaller of the three groups. Well, really smaller of the two. No, it was three at that time. I'm sorry. Yeah, it was three at that time. Um, and it was basically 50-50 female and male, and they had been in the area since, like, I think the 70s or 80s.
Okay.
So they were well established here in Panama City.
Panama City, Florida.
Yes,
And
Panama City,
those of
Florida.
us outside of Florida have maybe a different understanding of what's happening in Florida politically, maybe to what is actually happening. You know, sometimes the news will blow things up, sometimes they under report what's actually happening. Have you experienced any racism, or have you felt threatened or like you didn't belong?
No, not really.
Good.
Not really. I would say it was more not work related.
Okay, not work related.
Yes.
Okay. So where did you experience that?
There's a couple of places I'm not sure if I was supposed to be there for the restaurant or the bar, but
Wow.
I didn't feel like, after walking in, I felt a little, I don't know if I'm supposed to be here, but afterwards, I mean, it was fine.
Okay, good. I'm glad to hear that. I'm glad that you feel safe, and that this is a good place for you to be and live and have your practice. So what was it like establishing your practice? Tell us a little bit about that, and how long have you been in practice now? 13 years?
I've
Did I
been
get
here 13, it'll be 14 years in August.
Okay. And you've been with the same practice the whole time, or
Yes, I've been with the same group.
great, great. And what's that experience been like? Have you helped them grow? Do you mentor other young doctors that come in now, and how does that happen?
We have become a teaching practice, so we do have some access to medical students there, in the local med school in Dothan, which is like an hour and a half away from here in Alabama. And they rotate through our office and follow us upstairs on labor and delivery and in the operating room. As far as growing our practice, I would say, yeah, we still 4 physicians, but now it's 3 female, 1 male, and he really is just one of the girls.
That's all.
Um, he totally is one of the girls. The man is used to being outnumbered. He has more female children than he does male, so he's just used to it. And we have, I have to think, 4 midwives that are with us as well, and that's been a recent expansion.
Wow, I want to talk to you about that, but that doesn't kind of fit in our topic. Let me just ask you briefly about that. How do you feel as a licensed medical doctor, an OBGYN? How do you feel about midwifery?
I love midwives. The ones that I have had the pleasure of working with, I really haven't had a bad experience in training. The 2 practices there had midwives. I learned a lot from them, and I don't have a problem with midwives.
Good, good. Let's talk about maybe challenges you face every day. You mentioned being in a restaurant or a bar and not feeling like it
Mhm.
was where you should be, or that you might not be welcome there. As you go about your day, whether it's at your office or going to the hospital, what are some of the challenges you faced over the years? And has anything evolved and changed over the last 13 years?
I would say probably when I first got here, I mean, we still are the minority here, but it would really, unless I was at work, I could go the entire day and never see another Black person. So that
Oh,
was definitely a culture shock. And it was a little bit isolating, but as I've been here, I've seen more and more influx of African Americans,
okay.
as well as we've had more of our West Indian population increase with Jamaicans. We've also had more of our Latino population come and stay. It used to be more of a migrant thing where they would come in and work for a season and then they would leave, but now they're starting to stay. So Panama City slowly but surely is becoming more diverse.
That's great. That's great news. Did you ever? I love your attitude and how positive you are about your experiences. I'm sure there have been things, and maybe you've just accepted them, that have happened throughout your life. And women tend to do that. We just roll with the punches, and then just get up and move forward. Do you think that your attitude, your ability to face any kind of challenge, whether it's racism or sexism, has come from how you were raised, or did this grow inside of you through your school experiences, or did you have an influence that helped you um, not feel like you were facing this all the time?
I think it was a little bit of both. I feel like my parents taught me you just go, you do your best, and let the job speak for itself. So either they're gonna like it or they're not, and all you can do is do your best, and do above and beyond to show them that you are the best qualified person for this particular job or role.
That's wonderful. Tell me, what's the most exciting part of your day?
It depends. I love doing the new, like, this is our first OB visit, and they get the ultrasound, and I always tease them because I see them for the exam first and then I get them the ultrasound. I always tease them and say, okay, well, now we're going to get you the ultrasound and figure out how far along you are and how many babies you have. Always giggle and kiki. And it varies from the reaction I get. The last one I had, she was excited. She was like, I really hope it's 2. And
Oh,
her boyfriend or significant other was sitting in the corner. He was like,
uh-uh.
She was like, well, you should be used to it. Your mom's a twin. He was like, no, no, still no. No, I don't do that. And then one, I jokingly told her, yeah, we'll see how many you're going to have. And she went to ultrasound and we heard her scream. We are like, what's wrong? Oh, she was having twins. And it was her second
Oh,
set of twins.
you just answered my next question. I was going to ask, that teasing that you do, does it ever come back to
Yeah.
bite you? It
Yeah,
did.
that poor woman was not mentally prepared. She was like, I just had twins. Why am I pregnant again with twins? I said, baby,
Oh
I
my
don't know,
stars.
but you got twins.
That's amazing.
Hmm.
Do you have any advice or wisdom that you can impart on other young women, and in particular, other young Black women that are interested in going into something like medicine or law that is historically a male dominated profession?
Mhm.
And what could you tell them about how you achieved this, how you have stayed where you are? This I'm just so excited to talk to somebody that is empowered. You are very, very empowered. You're an empowered woman that has, I don't know if you've done it yourself, your parents, if it's this combination of, it's a combination of all of these influences in your life that has allowed you to be empowered. How do you help other women to have that same feeling and not feel downtrodden or like they can't get through or the challenges are too much?
I would say you need to form a good circle. And I feel like, especially in med school, that was really helpful for forming like a circle, a friend group, or having a mentor who you can bounce off ideas, thoughts that you can go to when you're feeling like you're kind of trapped, or that you're facing obstacles and maybe they can help you through. I still talk to a lot of my circle from med school and residency, and we still vent to each other about things that are happening in our practice or in our life. And I would say that was the main thing. Also, prayer.
Prayer.
Um, because as you're going through this process and you're going to be a physician, you're going to med school, residency, life is still happening around you at the same
Right.
time. So it's not just stressors of work, education, training. You also have family life, friendship life, relationships that are going and playing in the background too, and it's all affecting you. So I would say get like a friend circle, prayer group, find a mentor, as well as start meditation.
Meditation. I was going to ask
Whatever,
you.
yeah, whatever you have to do to kind of basically fortify yourself.
Yeah. So, what do you do besides pray and meditate in your downtime? What do you do
I
for fun?
I love to read. I am totally one of those chicks that will go into Target, bookstore. I mean, you can drop me off like I'm a toddler and I will be there all day. I recently went to Ohio to visit a friend. She's also in medicine. And in Columbus, they have this bookstore that's like 3 city blocks. And
Oh my.
I was like, okay, yeah, it was really like a tag team. They gave us a map, and I ran and I got an armload of books, and then I dropped it off at the checkout stand. It's like, I'll be back. And I went to the other side and I picked up more books and I dropped those off and was like, I'll be back. So yeah,
Did
I
you
have
have
a
to
book.
buy an extra piece of luggage to take all your books home with you?
I
Or did
think
you
I
ship
think
them?
I did end up having to get another suitcase to bring my books home. And that was the one place I was like, Angela, I have to go here. And she said, okay. And she didn't think anything of it. And then she got in there. She was like, I forgot who I brought. I forgot.
I forgot.
Yes.
Well, she remembered real quick.
I also travel a lot, just to get out and basically detach.
That's good. That's good to get away from it because I know that the job that you do is stressful, and especially when it's those days that you're on call. How does that work? Do you share on call responsibilities
Mhm.
with other doctors if it's a special patient? I know that I had a bad experience. I had a miscarriage and my doctor who I adored was out of town and I had to work with his partner and it was a horrible horrible experience. And from then on I was so afraid that I wouldn't get my doctor who I loved, who knew me, who understood me, who I felt comfortable with, that he would be gone. So how do you manage that?
That just depends. There are some patients that we will tell them, hey, we'll give them a card and say, hey, if you go into labor, um, and I'm in town and available, I'll come in. And
Yeah.
that goes with the midwives as well. They do that as well. But basically it's a templated rotation of
Okay.
call days. So I'm not necessarily on every day, but in a month I'll do 7 days and it just is spread out.
Okay.
Like tomorrow I'm on call. So it'll be 24 hours. I'm on call. Anything that comes through labor and delivery, the first person they'll call is one of the midwives, whichever one is on with us that day. And then if it's for a C-section or if it's one of our patients we've pretty much seen the whole time, if she so happens to come in, we'll get her, excuse me, or if there's an induction that we've put on, like we're inducing someone's labor and she's one of our patients, we would manage them. We're also responsible for anything that comes in through the emergency room for our patients. So if she comes in
Okay.
with like a miscarriage or an
Right.
ectopic pregnancy, we would manage those.
Okay. And then I want to ask you something that maybe nobody asks you this or feels like it's silly to ask. Is there an average time that a baby is born?
No.
Because all 4 of my children were born between 5 and 6 p.m.
No, it varies.
Okay, so it's fair. And last question for this on this topic.
Mhm.
Is there a time a month that more babies are born? Like the full
Okay, I'm not gonna
moon
lie.
or
It does get kind of busy around the full moon.
Really?
Yes, it does get very busy around the full moon. Also, if the weather is bad, especially if it's really heavy rain, for whatever reason, it seems like they start popping out.
That's interesting. So maybe it has something to do with atmospheric pressure.
Yeah, I think the barometric pressure kind of
Yeah.
shifts and changes and it kicks some women into labor. But yes, definitely around the full moon, it kind of picks up.
Interesting. Interesting. So now I would love your expertise as a physician, and we'll wrap with this. As a OBGYN, if you were to meet a young mother, somebody who comes in for their first visit with you, they've just found out they're pregnant, you confirm everything looks good with the pregnancy. What is the best advice? We're still in COVID. There are still so many cases every day. So we're kind of learning how to manage that and masking when you're coughing or anything like that. What kind of advice would you give to somebody that is very concerned about their pregnancy? Everything looks normal to you. Everything's normal. So what kind of advice would you tell them? Like standard advice that you give to your patients so that they can have the best possible experience as a new mother?
I would say ask all the questions you can think of. I mean, there's really no such thing as a stupid question or a dumb question when it comes to you and your baby. I would definitely ask her what concerns she has, what's making her nervous about the pregnancy, to figure out, okay, can I pinpoint where is it coming from? Are you just excited and scared of the whole pregnancy process and
Yeah.
delivery, or is there something specific that you're concerned about? Is it more COVID, flu? Like what exactly is making you uncomfortable? And I would say, I always ask patients, bring your questions to the appointment,
Good.
regardless of whether it's a notebook full of questions, it's on your phone, because most people always have their phone handy. You can jot it down in a note and then just bring it to the appointment. I even ask the family, do you have any questions? Because sometimes they'll ask their their family member that they are always around. They usually come with them to their appointments and they'll ask them a question and then they get reminded, oh yeah, you did ask about this
Yeah.
stuff.
Yeah. Good. Is there a good resource? What's the best book out there right now? Because my mom I had babies a long time ago, the Dr. Spock book, and I threw it away. So what's a good resource now for young mothers? When I was having my first child, it was What to Expect When You're Expecting, right? That was the standard Bible that every newly pregnant mom carried around in the 80s and 90s. So what's going on now? What's a good book?
Now they're mostly turning to Facebook groups,
Great.
actually, which
So
can
a
be helpful,
digital
especially
resource.
if you have some experienced moms in the group. It's very helpful. That gives them a little bit of support. But sometimes I will want you to go and ask your provider, or whether it be a
Right.
midwife or a physician, hey, I heard about this, what do you think about it?
Yeah, that's great advice. Well, thank you so much, Dr. Mallory. I really appreciate you hopping back on. I guess one last thing I want to ask is, why do you suppose it's still so hard for women to talk about their health and private issues?
I think because we've always been taught to put everyone else first before us. So we kind of put everything to the back burner and it's not necessarily discussed. People don't have those type of discussions with, well, I'm not going to say that they don't, but a lot of women don't have that type of discussion with the other females in their family unless something is extremely wrong. And then they find out, oh, that's not normal. You don't have that too.
Yeah.
I would say that's probably, I think, the biggest barrier. And sometimes it's just, we don't, as providers, we don't necessarily always ask them these questions at their like annual exams when we're typically seeing them. We ask more in-depth questions when they're pregnant, but as like a routine annual, sometimes we get caught up in the routine of it and forget to ask some of these questions like, how are your periods?
Right.
Are you having any pelvic pain? Are you having any issues with urination, stuff like that?
Yeah. That's so important to really know your body and be ready. Have that note section on your phone filled with questions so that you can walk away feeling like you've had a good conversation and your head is filled with knowledge now, and put your mind at ease on some things or learn something new about other things. If let's remind our audience of your practice. What's the name of your practice?
Our practice is all about women, OBGYN.
I love that. All About Women, OBGYN in Panama City, Florida. My guest today has been Dr. Roslyn Mallory. Thank you, Dr. Mallory, for joining me today. I really appreciate it. It's been always a pleasure to talk to you.
Thank you.